Hello again, I'm Dr. Mountain. Many times patients ask me to do tests not routinely done by their medical doctor. Now why would they do that? Well, often they're frustrated. They believe they have a health problem, but no one seems to be able to find it. My goal is not to talk negatively of medical doctors. In fact, most of my training is conventional, and I have a good working relationship and appreciation for what medical doctors do. In my practice, I have the ability to do a wide variety of tests, which I'm going to talk about on a future video. But today, I would like to talk about a hormone test, fasting insulin, and it is actually a conventional test, but it is not routinely done. Insulin can actually be involved in fertility, but as most of us know, it helps control our blood sugar, and that's what we're going to talk about today. The routine tests done in this area are hemoglobin A1C and fasting blood sugar, or fasting blood glucose. And these are good tests. The problem with these tests is by the time they are flagged high, or by the time they go off parameter, multiple mechanisms of your cellular blood sugar machinery and your metabolism and your blood glucose control have already derailed. There's already a problem present. So in that sense, these tests are reactive. Now don't let me scare you. It doesn't mean you're not fixable. It just means that there's already a problem present and it's been happening for some time. The advantage of measuring fasting insulin, so we'd send you to the lab in the morning after 10 to 12 hours since your last meal. The advantage of that is fasting insulin often will start to elevate years before your blood glucose or your hemoglobin A1C will go off parameter. This is important because insulin may be the hormone involved in people's struggle with fatigue and losing weight. It's one of the strongest fat-preserving, fat-storing hormones. It may be stronger than estrogen or cortisol. So, the reference range for fasting insulin after a 10 to 12 hour fast will say less than 120 picomole per liter. That's for the Calgary Lab Service. Now, we know if your fasting insulin is 300 picomole per liter, you're significantly insulin resistant. Or if you're 130, you're mildly insulin resistant. But here's where it gets controversial. What if your insulin is 118? It's not flagged by the lab. What if it's 105? Does that mean it's okay for you? Does that mean you won't have any effect on your hormones or your symptoms? So I have the luxury of doing a wide variety of tests. Fasting insulin is inexpensive, and knowing your number could be very powerful to you. Thanks for watching. Please subscribe and hit that like button, and I'll do my best to make more videos in the future.